is Ilona.
Vera, nice
Hi.
to meet you.
Nice to meet you too. Well, thank you so much for participating in this interview about global health. I'm specifically interested in your view about healthcare in Holland, and I'm specifically interested in your views, perceptions, and experience in Dutch healthcare. This interview will take approximately 30 minutes. Your privacy is absolutely protected. I will put it on YouTube and with a secured data link. So you don't have to worry about that.
Thank you.
Okay. Well, before we get started, I'm going to ask you a couple of questions about yourself so I can introduce you to our viewer, and we're going to discuss a couple of statements.
All right.
Okay. Well, where are you from originally?
Hungary.
Hungary. Okay. And how old are you?
32.
32. And how long have you been living in Holland?
At about 2 years, almost 3 now.
Okay. Well, that's very nice to hear. And do you have any other places where you lived before you went to Holland?
In Belgium.
Belgium. Okay.
Yes.
And how long did you stay there?
A couple of years. Not so
Okay.
long.
All right. And what made you decide to come to the Netherlands?
To start, I was hoping to find a country where I can put my roots down
Mm-hmm.
for business and anything else.
Mm-hmm. Okay, well, perfect. So you're also looking for a way to start up your business, maybe
Yes.
for better prospects also.
Yes.
Okay, perfect. Do you have any other siblings or family in Holland?
Nobody.
Okay. Wow. If you had to choose between countries, which country do you think is your own culture, or do you consider your own culture, or has the biggest influence on you? Because you're from Hungary, you used to live 2 years in Belgium,
Something like that.
something
yes.
like that, and now almost 2 years in Holland.
Yes. Yes. Hungarian is my culture,
Mm-hmm.
probably. The culture that the most influences me, I think that's from all the 3 countries, the Dutch culture. I like the easygoingness, I like the positiveness,
Okay.
the optimistic
Mm-hmm.
of this country.
That's very good to hear. And when you came to Holland, were there specific things that you thought was, oh, that's quite odd, or a cultural difference you noticed right away when you were going to Holland?
Absolutely, yes. The Dutch culture is so very open
Mm-hmm.
comparing to ours.
Okay.
You can see that everywhere, how people talk to each other, complete strangers on the street,
Mm-hmm.
no boundaries, how people live, no curtains closed, everything is projected to the outer world.
Mm-hmm.
They don't have that distance that,
Distance between people.
yes.
Okay. For instance, if you would walk into a street and the curtains were open, it's very odd to you because you're not used to that.
Yes, I
Okay.
come from a more
Restricted.
yes, you can say it like that. So this is mine, you know. This is like private. We keep more private things from
Okay.
the outer world.
And do you still notice any of these differences nowadays? Because you've been living here now for 2 years, so.
Well, I noticed, but I got used to it. So it's like, you know, you still see the open windows and people sipping their tea and watching their television and kids running around. You still see that, but you don't stop and find it no more awkward because you see the whole country.
It's quite normal.
Yeah, it's quite normal here.
Okay, well, that's very clear. Well, thank you so much for your view and experiences on basic cultural differences. I would like now to go to the next subject, that is your view on health. What do you think is your definition of health? When would you consider someone healthy? And do you also think that the way you feel that is normal for all Hungarians?
Well, I think that I can speak for most of Hungarian people
Mhm.
because I consider myself healthy when I feel alright,
Yeah.
physically, mentally, emotionally. Now a little bit of light headache cannot say about me I'm sick or something. So I think someone is healthy when he or she feels good.
Okay, quite clearly, thank you so much. Well, we're going to discuss now your view on illness, because you just told me your view on health, and of course the opposite is illness. When would you consider someone ill?
Ill, in my opinion, is is something more than just sick.
Mm-hmm.
When I consider someone ill, when the person has permanent damage,
Mhm.
suffered a permanent damage, has a chronic disease,
Oh yes, of course.
something to live a lifelong, you
Mhm.
know, something to have to take care about on daily basis, like diabetic, like
Some
a
other
handicap,
illness.
you know,
Yeah.
like things that make your life harder than
Mhm.
it should be.
Yeah.
I think then we can talk about someone is ill.
Okay, well that's very clear. And how do you feel about people with mental illnesses such as depression or maybe something even a little bit worse, schizophrenic?
How do I feel about it?
Yeah, do you consider that also a state of illness or a state of sickness or?
Definitely, I think it's a state of illness,
Mm-hmm.
since the person is the way it is, unless it's getting medication. But even in that case, getting medication, it's the right thing to do when
Mhm.
someone is ill.
Yes, of course.
Or a treatment, if
Yeah.
it's not a medication but a treatment, it becomes a lifestyle for the person with that difficulty and damage to have to live.
Yes, of course, you have to live with it every day.
Yes.
Yeah, well, that's quite correct indeed. Yeah. But what do you think is the difference between a Hungarian view on illnesses or in relations to Dutch people? Do you think they think about it a different way or do you think it's similar?
No, I think it's similar. It's maybe the approach is
Mhm.
different in the two
Okay.
countries.
Can you enlighten me about the approach?
Under approach, I mean, in Holland, you're not very easily declared sick.
Mm-hmm.
You even more easily declared ill,
Mm-hmm.
but less easily declared sick. In Hungary, the pharmaceutic industry is the biggest industry, and you can see that also on the amount of prescriptions that doctors are giving out on a daily basis. In Hungary, it is common to receive meds
Yeah.
for anything.
Okay, I didn't know that. So they are very easily to prescribe you something.
Very easily to prescribe something.
Okay.
Yes,
Well, that's a big difference then in Holland.
absolutely.
Okay. Well, if we're talking about healthcare and the way that people are with medicines or maybe budget, what do you think is the difference between Dutch people or Dutch healthcare and Hungarian healthcare in relations to the role of the government? Does the government have a big role in healthcare in Hungary?
Well, the role that the government takes in the healthcare in Hungary is basically the financializing, financing the hospitals, the healthcare, the budget to decide where it goes, who gets it, who gets sooner treatment, who gets later treatment. But we all have to pay approximately 10% of our brutto salary,
Okay.
and that goes to the government, and then the government will put it like, you know, like one part is to treating sicknesses. So when you go to your GP and you got the flu or you got something worse or you broke your leg.
Yeah.
Oh no, sorry, you broke your leg. It's in the other category.
Okay.
So when you need meds or when you need treatment or when you need to go further to specialists, that's in one budget. And the other budget you get when you're on sick leave or maternity leave for the ladies, you know.
Yes.
So it's in a form of finance because you have to stay home, you have to stay out of work.
Yes.
So you will be repaid for the period of time until you are fit again
To work
do.
again or to
Yes.
do it. Okay, well that's quite clearly. Do you know the difference between Dutch healthcare systems and the way it works here? Or?
No, not really. I know that we pay a huge amount towards the healthcare.
Yeah, that's quite correct indeed, because we pay like €100 or €120, something like that.
Yes.
Depends on your insurance.
Yes.
And we all have to do this.
Yes, that's true. I do agree with everyone has to pay. I only see it a little bit ridiculous amount because unless something real thing happens, like per se you fall in coma
Mhm.
or you get hit by a bus
Yes.
or something really huge happens. For the rest, you don't get too much back. Because my experiences with GPs in Holland, you don't get too much back. It's a little bit here more. What we don't have in Hungary is the home pharmacies.
Okay.
At the drugstore, you can just take anything, unless it is antibiotic or a steroid. You can buy anything for yourself.
Okay.
You
You
can-
mean like the ATOS and the DA's?
Yes, the drugstores.
Stores.
Yes.
Okay.
So it's a little bit like cure yourself,
Mhm.
but it is fine and good
Mhm.
for one for some things, but
Mhm.
again, another things should be seen by an expert.
Okay, so if you had to choose, or do you prefer the Dutch healthcare system or the Hungarian ones, or?
Well, I think they both have something good to offer,
Okay.
and they both have something that they lack.
Mm-hmm.
So I would pick the better things from both healthcare
Yes.
and put it together.
Okay, well, thank you. That's very clear. I now would like to go to the next subject. That's debate on elderly care. I'm going to tell you one statement, and you can tell me if you agree with the statement and why or why not.
All right.
Okay, here we're going to go. It's normal to put your parents in an elderly home when they can't take care of themselves anymore. Do you agree or you don't agree?
Well, it has an open question to me. Is the person in the state of being able to take care of his or her parents on his or her own? In that case, I would definitely choose taking care of your parents because they took care of you.
Yes.
When the person is not in a position, due to whatever serious reason, I see no other choice. When your parents are really not capable anymore to take care of themselves, and it is not safe anymore to let them alone, you don't have another choice. First of all, I would always try my best to take care of them on my own.
Okay, well, that's indeed a clear statement. Well, if you had to, can you tell me how the elderly care is arranged in Hungary? Is it the same as in the Dutch views, or what's your point of view on that?
We have also elderly homes. Too many people, they take care of their parents on their own,
Okay.
but that's because of financial problems, struggles.
Yes.
These homes, they cost a lot of money, and they are also really low equipped. They do not offer good quality. And then again, if you don't have another choice as a Hungarian but to put your parent in a home like this, what will make you sure that your parent is in good hands? You don't know that, and unfortunately we have very bad reputation
Oh, okay.
about.
So how do you think elderly care should be arranged?
Well, definitely a lot better. A lot more budget should go to the elderly care. Shouldn't be put in the pockets of directors and stuff like they have
you
in
think
Hungary.
it should go back to the people who need it?
Absolutely, yes. So actually, we pay too much towards the elderly care and hospice and those kind of things. But unfortunately, most of the money is going into the wrong pockets.
Oh, okay.
That we have also a bad reputation about being corrupt,
Okay.
and that's correct. So at the end, who is going to be the victim? Is the elderly people? Yes.
Oh, that's quite sad indeed.
Yes.
Okay. Well, I'm glad you shared that story with us. I would now like to continue with, we're staying a bit in the same subject. We're going to talk about life expectancy now. In Holland, a big part of the care budget actually, is contributed to elderly care because of the growing numbers of all the Dutch people. And our overall life expectancy is about 80 years. Do you perhaps know the average life expectancy in Hungary of men and women?
I thought it was about 70 approx.
Approx, okay. Well, it's quite accurate actually, but in the latest 10 years we have an increase. When we look at the numbers from the latest publication of the World Health Organization, which they published in the year of 2015, the average life in Hungary has increased, and especially women, their life expectancy has increased with 9 years. That means that the overall life expectancy of women in Hungary is now 79, and men, unfortunately, are still stuck at 72 years. Do you have any idea how that could have happened?
With the modern Russian world, I couldn't think of anything else. I don't know. Maybe, perhaps, the older generations, which you say exceeded with life expectancy, they have started living quite early in their teens. For as long as I know, working already as a teen.
Yeah.
In today's world, I think that most people start long after the 20s because they study as long as they can. So actually, it's a kind of like I could imagine possibly we won at least 10 years on getting out into the world 10 years later than the previous generations had to.
Okay, yes, indeed, it's a possibility indeed, because we're at a later age getting started with work. We're not doing as hard labor as we used to.
Getting kids is also no more in our early 20s, but early 30s.
Yes.
So possibly, maybe,
Yes.
I don't know.
Okay. Well, I don't know either, but I'm just very curious about your point of view. I would like now to go to the next subject. That's the personal experience with Dutch healthcare professionals. Well, to start, have you ever been in contact with a Dutch healthcare professional?
Absolutely, yes.
Yes, and was this a dentist or a specialist in the hospital or a GP, a general practitioner?
I've been to GP.
Okay.
I've been to dentist. I have a dentist. I been to a gynecologist.
Okay. Well, that's quite a lot. Were you put on a waiting list before you could see him or her, the gynecologist?
No, I think it was just not really a waiting list. It was just a regular make an appointment, and it's, this week isn't working out. Next week we have time for you. Come down.
Okay, well, that's indeed quite normal.
Yeah.
A couple of days. Well,
Yes.
in some countries it could take like months.
Yes. Certain specialists, yes.
Yes. Well, can you remember if this gynecologist was a man or a female?
Well, I've been to different ones since I was staying in different cities. They've been both male and female.
Okay, perfect. And would you rather have a male or a female professional if you had to choose, or?
Before, like in my teens, of course, I would rather have a female. But now I want to see. I want to talk to an expert. I want an expert take a look at me. I want his skills, to be able to trust his opinion.
Yeah.
So I just see it's an expert, whether it's female or male. It's an expert.
Okay, well that's very clear, because some people don't want to be treated by a man or a female, because, for example, if you're a Muslim, you would rather have
yes,
a male or a female.
No, we don't have that. We don't have that. We are quite equal.
Okay, that's good to hear. Well, can you remember how this professional, how this GP, or how this gynecologist made you feel during the treatment or during the intake? Did he make eye contact with you?
Yes,
or?
absolutely friendly. Yes, absolutely friendly, professional, helpful.
Okay.
Everything was good.
Okay, well that's quite nice to hear, because in some cultures, for example in the Chinese culture, if you look someone in the eye, it's a sign of disrespect. So
this is very strange, but I heard in Denmark they don't have the 45 centimeter private zone.
Okay.
They just enter your private zone,
really?
and you feel really frustrated because you have your private zone,
Yes.
but it doesn't exist by them.
Oh, that's also a cultural difference.
Absolutely.
Nice to hear. Everybody is different, exactly.
Yeah.
Well, I'm just gonna go on. Oh, well, my last question about this subject is, what do you think is the biggest difference between Hungarian health workers and Dutch health workers, or is there a difference?
A difference in between the workers.
Yeah, the workers.
The
exactly.
experts,
The GPAs, the nurses, maybe even the elderly care workers.
Nurses and elderly care workers are very not satisfied with their salaries, and they reflect us
Wow, okay.
in their daily lives. with the patients.
Mm-hmm.
Also, certain GPs or specialists that they are working really governmental, they are working in hospitals, and they just do really a mass production of each day of patients, they have to deal with.
Mm-hmm.
You feel you're unwanted. You feel that you are a little bit, they're like that.
Mm-hmm.
But that's because a lot of our experts travel to different countries because they couldn't earn enough for their education, for their knowledge.
Mm-hmm.
So they just left our country. So we have really a small amount of experts that they stayed behind, and they are not really satisfied.
Well, yeah, I can understand that. So if you would need specific care or care of a amount of quality, it's very hard to get that in your country.
Absolutely. So when you have the budget,
Mm-hmm.
then you go. Then you prefer above you pay your 10% every
Mm-hmm.
month. You prefer to go to a private clinic
Okay.
because you really what you pay for you get also.
Okay.
It is not being a patient there; it is being a client there.
Oh, that's indeed a different view.
Yes.
Very different view.
It is unfortunately unaffordable for the middle class.
Mm-hmm. Because, for example, how much do you think such a treatment for in a private clinic would cost compared to a normal clinic? Do you have any idea?
A regular intake costs about 30 euros
Mm-hmm.
on a private clinic, which you don't get too much for because
Mm-hmm.
it will be considered which experts you're gonna need for your questions to be
Mm-hmm.
answered. So then they're gonna send you further. Each visit will cost you at least 30 euros for the intake, but it varies when you go to a cardiologist.
Mhm.
It costs you 300 euro for one visit,
Mhm.
for one checkup. So I mean, people in Hungary earn about in between the 200, 250 euros to the 500 euros, something like that in between, and that can be also brutal. So 300 euros for a cardiologist testing, it is unaffordable. And 30 euro, it's like 10% of their salary, which is also unaffordable. It's like you would pay 150 euro for just an intake, just a visit to your GP, just a visit to your gynecologist, 150 euros each time.
Wow.
Above that, you're paying what you need to pay for the healthcare.
Wow.
So
that's
people don't choose for that, no.
No, I can imagine. I wouldn't know how to do that if I would be in their situation.
Yes.
Wow. So, and if you do need that special care and you can't afford it, you have to go to the people who will treat you like a number.
Yes, and then you're gonna get approximately between the 3 months and the 6 months waiting list. Like my father had to wait for a cardiologist checkup, and that was quite an urgency because he was diagnosed with a heart condition. So it's like it's like 3 to 6 months waiting when you're diagnosed with something.
Yeah, what would happen if someone in this amount that he has to wait is 3 months and something worse happens? What you gonna
Bad
do
luck.
now?
Bad luck. That's
Yeah.
life.
It's quite harsh indeed. I can understand that a lot of people who are skilled are going to other countries, but I can also imagine for the people who are still staying there,
Yes.
it's
Yes.
quite difficult.
Yes. They learn to deal with that.
Okay. Well, thank you so much for sharing it with us. I would now like to go to the last 3 questions of this interview. That's rating the healthcare system. If you had to give the Dutch overall healthcare system a number between 1 and 10, which 1 is terrible and 10 is excellent, which number would you give?
I would probably say about an 8.
And why would you give an 8?
Because it still lacks something very important in my eyes and in most people's eyes. It's prevention. I believe in better safe than sorry, and the Dutch healthcare doesn't believe in it. Probably they are very well equipped and they have a lot of money in their budget, but to bring back people from almost death. I would prefer to screen diseases and to be treated, even for a sickness, to be treated a little bit more careful. Because when you don't take the right medication, if you need a medication, it can hit you back over 10 years, 20 years, and that's just because of you've been lacking the expert's advice. So I would really like when Holland would work
more
on it
about
to do a bit more, yes, on prevention.
Okay. Well, that's very clear. If I had to ask you the same question about Hungary and rating the healthcare system of Hungary, which number would you give them then?
Probably somewhere between 5 to 6. And that's because we get 80% of the times, probably not all the times, prevention, but for the rest of the things, it's just not what healthcare should be.
Okay. So that's 5, 6 for Hungary and 8 for Holland.
Yeah, an 8, in my opinion, an 8 is quite okay, because I've never given a 10.
No.
But seriously, like a cervical cancer test that every woman above a certain age should check once a year. In Holland is in between the 3 to 5 years.
Yes, it's between 1 to 3 years or 1 to 5 years.
Yeah, so even the last doctor that I was talking to was a gynecologist in Hungary, and told me last time he was in Congress, he unfortunately heard, and it was Holland that mentioned, it's enough once in 3 years to check cervical cancer. It is not enough. When something is wrong, it goes wrong during that period of time. It's too much weight.
You think it should be more, maybe each year?
Sooner, yes.
Better safe than sorry.
Probably each year, yes. But maybe it will be also nice to let the patient, to let the civilian to decide, what he wants to do, and not being rejected.
If you want to go faster, sooner.
If I would want to test something on me, I think by paying that amount of money, I have the right to get tested on whatever I want to get tested. I should not be rejected, but I get rejected.
No, I can understand. That's not nice, because if you really want to get tested and it's not possible, because Dutch only does it 1 in 3 or 5 years.
Yeah, because you know what the Dutch healthcare believes in, it goes very much on the numbers. It believes in statistics. Like how often did it happen? Someone passed away because of lack of cervical cancer tests. But I mean, like, I don't want to make that example. No one wants to make that example.
No, of course, I can understand that. If statistics say it's 1 in 5 or 1 in 10,000.
Yes,
you could be the 1 in 2.
You could be, yes. You have the same chance to be that.
Okay, well, that's very clear. Something we should definitely keep in mind.
Yes.
Well, I would like to thank you so much for participating in this
You're
interview. Your views have been very enlightening. We've discussed a couple of subjects: your view on health, your view on illnesses, your view on elderly care, and of course the comparison to Dutch healthcare and Hungarian one. So thank you so much again, and I would love to give you my hand and see you soon.
You're very welcome. Thank you very much for having me.
Okay, thank you.